Good morning, afternoon, and evening to all our viewers joining us from different parts of the globe. And welcome to High on Data, where we discover, debate, and decode key industry trends. I'm Parijat Banerjee, Global Head of Financial Services with LatentView Analytics. And boy, I have never seen such enthusiasm in adoption and exploration of AI across industries as I see today. And maybe a few decades from now, humans will look back at 23, 24 as an inflection point when the digital revolution transitioned into the AI revolution. So you get the hint. It's going to be an intriguing discussion today, and we are going to unpack what that means. And to do that, I have none other than Zoher Karu, Head of Analytics at Blue Shield of California. Zoher, welcome and thank you for making time for this discussion today.
Thank you so much, Parijit. Great to be here and great opportunity to chat with you. So I'll just introduce myself briefly. So Zoher Karu, as Parijit said, I'm leading data and analytics at Blue Shield of California. I've been here a little over 2.5 years. It is actually my first stint working in the world of healthcare, but I have been leading data and analytics functions in other industries for many years. Most recently, I was doing it for Citibank's consumer bank for all of Asia and Europe, based out of Singapore. And before that, globally for eBay here in California. Before that, I've worked for large retailers, some even smaller startups doing interesting work like tracking customers inside of retail stores, using video cameras, doing call center analytics, and initially got my start working at McKinsey and Company. So, seeing data analytics evolve over the years, even before it was officially, I think, a career, if you will. But glad to share some of my thoughts today with you.
Awesome. And welcome again, Zohair. Well, research points out that the health insurance industry is one of the largest growing industry in the US. It's estimated around, don't quote me to it, but around 310 million. Approximately 90% Americans, adults are insured, 65% with private, 35% otherwise. So here it goes, right? The way I wanted to look at was if we look at the first part of change management, right? That is needed for organizational success in data and analytics. We all speak about it, but this has many nuances. It has nuances like the tactics of data assimilation, interpretation, democratization, creating a connected ecosystem, and then equally intertwined is this organizational culture and the vision of data. My second point wanted to cover is this exponential rise of AI, and thus this crucial dialogue that we've had a few times around data governance, which is central to build intelligent systems. And third, this virtuous triangle, it can be virtuous or vicious, triangle of payer, provider, and patient, and this impact of data and AI to bolster or temper expectations, especially across financial services and especially insurance, which continues to be a pillar of societal welfare. So let's begin, right? My first question to you is on this organizational vision for change management in data and analytics. I think insurance is at this pivotal moment, and you're at the core of that. There are technological disruptions that are happening, consumer shifts that are going through in the business S curve. And now, in this phase of change management, in my view, everyone is both a learner and a tutor in that sense, right? So when I think of change management, I'm reminded of this 100,000 student classroom analogy. It goes like this, right? In the fall of 2011, Peter Norvig taught a class with Sebastian Thrun on artificial intelligence at Stanford. It was attended by roughly 175 students in situ and over 100,000 via interactive webcast. Now, this was revolutionary. This is nearly a decade before COVID changed our work patterns. Now, considering convenience and conviction never shared the same zip code, change management in data and analytics needs serious focus across insurance organizations and especially in the CXO suite. What behaviors do you see that's hindering or helping this transformation, Zohair?
Well, it's certainly a good point. I think you hit the nail on the head in saying that change management is a necessary part of any data and analytics journey. I think it's often ignored. People are focusing solely on the technology only, and neglecting the fact that change is necessary in order to adopt any of these new methods or insights or technologies that come to the table. And certainly, we're seeing a lot of change in front of us with the burst onto the scene of generative AI, for example, in the last year and a half, 2 years. And so, the problem, or the genesis of the problem, in my opinion, is that a lot of these companies that we are all part of and working with, and this is not an insurance only problem, right? It is cross industry, is that these companies have been around for long periods of time, doing quite well without any data and analytics formal, team or support or technologies. And suddenly we are introducing data and analytics to organizations, whether it's centralized or distributed or otherwise, but taking full advantage of those requires change, requires somebody to do something different than they were doing before. And if we're all not collectively understanding and appreciating that, it becomes, hammers looking for nails or otherwise, right? Where we're just trying to push certain approaches like, I don't understand why you're not using my predictive model to target your marketing campaign or whatever else, right? I mean, because it sounds very logical, and all the logical people can't understand why the business doesn't want to do it, but they need to understand that it requires a change on the business side, right? Any introduction of technology requires change, right? The introduction of automobiles required change, or telephones, or anything else, right? Computers, cell phones. We're seeing change, and so uh, by nature, people are generally resistant to change, right? And the only way you have to attack that problem is to break it down into smaller and smaller chunks, so that the small change is of such low risk that people are willing to take it, right? And they're willing to try it. Some people are more earlier adopters than others, but nevertheless, within any organization, you can find some folks more willing to change than others, and starting there usually gets the ball rolling.
Fantastic, Zoher. Perfectly makes sense. I think breaking it down into small pieces that people can appreciate and start running. And I'm sure it's a top-down process, as you rightly mentioned. Um,
Yeah, I think look, it's like this. Like, if you can't just say, "Wow, you should go to the gym every day." Like what? Like that's a big change for people, right? Maybe it's like maybe you start with, "Hey, how about you have one cookie instead of two cookies in the afternoon?" Okay, let's start with that, right? Like I mean, you can start small and something that's doable. Like, so when you're working in a corporate environment, maybe you don't want to try to affect the biggest product or the biggest geography or the biggest customer base or biggest what. Like, you start with something that is of low enough risk that people are willing to try something different, and that can open people's eyes. So if you can close the loop by trying and then measuring, doesn't mean you'll always be successful, but getting that muscle of trying things makes people more willing to change and try things. And nobody wants to change for the sake of change. It's change to do something better. So if you can if you can be viewed as this is going to help you achieve your goals, I think you will encounter less resistance to, well, of course I want somebody to help me with my goals. Why would I not want somebody to help me with my goals, right? And so, but you have to break that down a bit so that the risk is reduced.
and do you see this, just to complete the thought on the question, do you see this happening? And you've been in, a lot of the Fortune 50 companies in your career. Do you see this progressing from the top, and
So,
specifically with data and analytics in mind?
what certainly you do need top-down support. It helps, right? Because if there's not top-down belief that this is going to help the business, it becomes a little bit challenging in parts. uh, the change that we're speaking of is usually not change at the top. The top usually says, "Okay, yes, I get it. Yes, we need to be doing something different." The change happens in the middle, where, okay, I've been doing this job for 10 years, 20 years. I've been doing it the same way for a long period of time. Why do I need to do anything different? I'm doing perfectly fine, right? And so that's where that sometimes requires some top down, suggestions, right, or pressure in some ways. A little, let's try something differently to see what happens. And so that helps. If you don't have any top down support and you have resistance in the middle, it does become challenging for sure.
Perfectly makes sense. Okay. Yeah, it is the middle layer. So that's great. Now, let me change the course of our discussion towards this second area of focus that I wanted to touch upon today. And this is the importance of data governance in AI and to build intelligent systems. So we are looking at change management, but as you're building AI systems, this is a very, very crucial focus area that I keep hearing about. And if you think of the history of AI, right, it parallels the history of computing itself. It reminds me of Alan Turing's 1950 paper that discusses how to build machines and test their intelligence. In the insurance world, AI seems to have enabled rapid analysis of complex data. It helps data scientists, helps actuaries, helps underwriters to determine their exposure and stuff. Claims, if you look at claim side of it, the analysis of claim, the losses, the commonalities, all of that comes in, right? However, I think the focus should shift from scale that works to what works at scale, right? In other words, ungoverned data strategy repeatedly leads to erroneous models. Um, Zoher, you being an ardent data practitioner, what's your view about this importance of data governance in AI, and especially from an insider's lens?
Yeah, look, data governance has, the term data governance is a broad term and people define it in slightly different ways. But it's gone through an evolution from, you know, being, uh, something that was critical maybe at the time of the financial crisis, whatever, and then it sort of became in the background of, oh, data governance, not so sexy. And now data governance is becoming sexy again, right? Because people are recognizing the need for good data governance. And the reason for that is that a lot of these AI solutions require large volumes of data to be as effective as possible, right? Large training sets integrated across multiple domain areas, et cetera. And without good data governance, some folks are struggling to say, well, I can't take full advantage of this technology because my data is scattered. I don't know if it's right. It's in different places. It's like it's midnight. Do you even know where your data is? Like, do you know where it is? Like, who's got it? Right? And then how do you bring it together to apply to these problems? Because now with some of these technologies, if you're not careful, you will just make bad decisions faster. Like that's not the objective, right? And so so governing the data. Where is the data? What's the definition of the data? Who is the owner of the definition? How often is it updated? Is this data in sync with this other data? Like, I mean, there's many aspects of data governance, right? And but basically, it boils down to, can you trust the data? First of all, can you find it all? But then, can you trust it? And that is a key prerequisite to a lot of these, large scale implementations or solutions, right? Like where I need to ingest large volumes of data to try to see the patterns that unleash some of the power that you're talking about, right? Like, is this a fraudulent claim? Like, you need large patterns of data to be able to answer those types of questions, right? And so you need information from lots of different places to bring together. So data governance is a pillar, and shouldn't be neglected by any means. I think, you know, you can't take it too far in the sense that you can spend all your time playing data janitor and cleaning up data, but you'll forget driving business value, right? Like, so you have to do a bit of both in parallel, and you need to think about specifically focusing on, if I want to drive this outcome, I need to do this analysis. To do this analysis, I need this data. So, like, starting from the outcomes will help you focus the data governance efforts. Because if you simply say, I need to clean up all of our data, like, you'll be at that for a couple of lifetimes, right? So,
That's great insight, Zohair. Let's pause on that for a few seconds because I think what you mentioned is so key. This whole balance between business value and looking at how much you spend time as a janitor of your data, taking your words, or governance. Now, if I think of the banking world, which you've been a part of for quite some time, over there the governance of data is extremely rigid. When we think of programs like the risk programs that used to run post the mortgage crisis, like Basel, CCA, Dodd-Frank, and
yeah.
others, there was a whole segment of making sure that we are focusing on governance, and that was the ask of parallel and pre-parallel runs. But when you think from an insurance angle, right, I'm sure there is How do you see this balance of business value versus data governance? Is it neglected? Is it done too much? What's your take there?
I think, well, certainly there's no shortage of data, right, in the health insurance world. It's, in fact, I don't even know how it's calculated or whether it's right, but people have said things like 20% of all of the data generated in the world today is from healthcare, which I'm not sure how you would dispute it or verify it, but it's but there's certainly a lot of data in the world of healthcare, and there's certainly still, despite us being in 2024, a lot of manual processes in the world of data. And whenever there are manual processes, there are human generated errors throughout the system, right? Doctors entering information or patients filling out a form or whatever that is. And so that requires a fair amount of governance on top to make sure it's right. You know, when I think about data quality, when people say, "Oh, we have a data quality problem," my first question is, "Well, how do you know it's wrong?" Because if you know it's wrong, then you can look for that and try to correct it as you go. So data, and the other problem is what makes data governance challenging in general is that people typically, it's human nature, use data or the bare minimum amount of data to do their one job in their part of the organization, right? Like, I don't know, a simple example might be a call center agent where one of the items or a task a call center's agent is supposed to do is choose the reason for the call. There's a drop down menu and there's 79 choices. And most of the time they just choose choice number one because what does it matter? They just need to move on to the next call. But the problem is that data is actually, while it may not benefit that agent immediately, that same data is super valuable to somebody else in the digital organization or the marketing organization or some other organization. And so this concept of data is actually everybody's job, okay, is a theme that needs to be permeated throughout a company. Data is not the job of this one team sitting in the corner. Oh, that's the data governance team. I don't need to worry about it. Like, that's a mistake. And so trying to create that culture that data is used for more than just yourself, right? And like I said, it's human nature. I don't care whether this data element is right or not. It doesn't matter to me, right? But it matters to somebody else. And so taking that lens of being broader and not being as selfish, I'll call it, with your data, I think benefits everybody. Is a big part of being doing data governance and being a data driven organization, because one small team or however big you think it is not going to fix it all, right? Like, this culture is needed throughout every company, in my opinion.
That's actually fabulous insight, because what you're trying to say is everyone is a data owner in the company. That culture needs to come in, and considering, if 1/5 of the world data is healthcare data, um, that's tremendous. Actually, that's a great segue for me to get to the third part of the discussion that I wanted to focus today, something that I'm very passionate about, and wanted to get your sense on this, right? This virtuous triangle, and I'll keep it as virtuous, between the payer, provider, and the patient, right? And I'll take an example, which I read. As per some stats that were shared last year, it showed that in America, chronic kidney disease affects nearly 40 million people, with more than a million patients having this end stage renal disease, or ESRD as they call it. Now, it's estimated that a whopping 140 billion plus, if you break it down, these are big numbers. If you think it simply, one in every $5 in Medicare is spent annually on kidney disease patients, which is only anticipated to increase. Now, healthcare payers and providers play two very distinct roles in the healthcare system, right? While they are being interlinked, I would think this relationship can be hugely leveraged to make up a crucial part of this value based care, right? For this ultimate consumer, which is the patient. Now, I understand there are myriad challenges. There's rising healthcare cost. You need to align your incentives. There's interoperability, just to name a few. And though we say it's at the center of this conundrum, and which it is, I still feel it's a hugely a data problem. And by that I mean, data sharing, transparency, creating member DNA. Some of that you're doing already that crosses boundaries. And now there is Gen AI, which has a lot of excitement and optimism right now in this space, and it's gaining popularity. How to leverage this data and run with it, right? So in the thread of governance, and everybody's starting to becoming data owners, and thus eventually trying to solve this trio. I believe curiosity and judgment can't coexist in this double-edged sword kind of a question. But in your view, Zohair, how do you position this virtuous triangle of patient, provider, and payer? And how does that impact betterment of our society as a whole?
Well, as I mentioned at the beginning, my first time officially working in the world of healthcare, we have all, as individual consumers, of course, experienced healthcare ourselves, right, in the healthcare system and its challenges. I, I would say there's two primary problems I've observed in the ecosystem of healthcare. One is disconnected data. Lots of different entities within the healthcare ecosystem have a piece of the puzzle about your healthcare background and history, right? It could be Doctor One and Doctor Two and Specialist One and Specialist Two and Lab One and Pharmacy Two, and like they all have a piece of the puzzle. So bringing that data together, interoperability kind of standards are trying to help make that happen, right? But there's a recognition that there's disconnected data. And two, uh, the and we are doing a lot at Blue Shield of California to try to make that happen with moving to an entirely cloud-based platform to make real-time data integration happen. The the second piece of the healthcare challenge is misaligned incentives, right? And the move towards value-based care, I think, is a big one towards aligning some of those incentives between provider and payer, for example, and making sure that we are spending our dollars collectively wisely and still receiving and getting to the right health outcomes for the membership base. So value-based care, I think, is the right approach. Payers and providers, they, as you said, sometimes view each other as enemies and they view each other as only opposite sides of the table when negotiating a contract and say, okay, I want this much money for this procedure and I want this much money for that. Like, but in reality, and I've been to a handful of conferences myself, like there's a recognition, at least in my mind, that payers and providers are often trying to solve the same problem, which is or are solving the same problem, which is keeping people healthy, right? And so there we have a care management program, they have a care management program, they have this, preventative care. We also have preventative care. Like what? Like we need to be collaborating more effectively and viewing ourselves as partners in the same outcome of health outcomes. And I do think value-based care is a path to making that happen, right? And aligning those incentives so that people align their behaviors to that same outcome.
I think when I hear about you saying that patient is at the center and everybody is trying to get towards the health of the patient, it reminds me of this wonderful quote, which is the arc of human civilization always bends towards justice, hope, and benevolence. So I wanted to extend that question a bit further, right? And I wanted to ask that value-based care is the core. That's what you mentioned. That's what I realize is the outcome to it. How do we make this more pervasive in this trio? Will it be people like you who are at the helm of the payer systems? There are people in the provider system. How can this get much more towards a solution eventually, or do you think it's going to take still a long time to go where we plan to go?
So I think the industry as a whole, you know, again, I'm still learning as well, but is working through a lot of these dynamics. I do think it is accelerating. I do think it's converging into more standardized practices. I do think regulations and things like interoperability and all of those things are helping move us towards that goal of improved health outcomes for our patients.
Fantastic. Drive analytics and change management from the top to the middle. Have your eye on the data governance and keep value based programs at the core of the patient provider payer trio, leveraging data and AI to build a better society for all humans. Zoher, you said that beautifully. Loved our discussion, and thank you so much for sharing your time with me today.
Thanks for having me. It was a pleasure being here. Appreciate it.